Welcome to Newsroom365 Situation Room. I'm your host, Maruf Hussain, broadcasting today on Thursday, the 23rd of April. And if you're in the UK, St. George's Day, congratulations to you all. And we're going to be talking about the latest political, national, and international issues that are pertinent to our day and whatever crisis that is actually coming up. And in the studio with me is my co-host, Fahim Aziz. Fahim, welcome to the Situation Room.
Hi, how you doing?
Excellent. Well, Fahim, what's the latest international news you were picking up at this moment in time?
Well, yesterday we had quite an important event yesterday because it was the first Prime Minister's question time, and Keir Starmer was asking some really important questions around the tests that the Health Secretary has committed to, which is 100,000, which was going to be done by the end of April. And he asked quite an important question that, you know, the day before yesterday it was 19,000, and now it's gone to 18,000, which is obviously a lot lower. It's a lower number when the curve should be going a lot higher by the end of the month. So the Health Secretary or the First Secretary is saying that actually we've got the capacity for 40,000. So they're really sort of changing the narrative behind what they're saying, and so they're saying that that gap is due to people can't actually get to certain places in certain time.
Didn't need correcting because I gave the.
Well, Fahim, let me ask you, the government have been setting new targets. First of all, it was something like 5,000, then 10,000, then it was up to 20,000, then they jumped to 100,000. Nobody knew realistically that could be achieved, yet they were very insistent that they could achieve their 100,000 target. And if they don't, what ramifications will that have for the UK and its lockdown?
Well, I think what happened at the time was there was a big hoo-ha around tests, and to try and deflect that, they said, "Oh, we're going to do 100,000 tests at the end of the month," and so that gave them a bit of a breathing space. But, you know, obviously, if they don't get it done, then they're not going to know who's got it, and then they're not going to be able to isolate those who've got it. So that the contact tracing part of this, which is really the key, until we sort of get a vaccine, is not going to be really validated.
Now, you mentioned contact tracing. It's an extremely important tool to combat the spread of the virus, because even though we're in lockdown now, once we are released to some extent, that situation is still live. Now, there is no consistent, coherent contact tracing strategy that's been outlined by the government at this moment in time.
The question is, what is the best package?
And so, I mean, I think it's quite interesting if you listen to this.
The exit from this is going to be one of two things, ideally. One of which is a highly effective vaccine, and there are a variety of ways vaccines can be deployed. They can be deployed for damping down epidemics. They can be deployed to protect vulnerable people, or highly effective drugs, so that people will stop dying of this disease, even if they catch it, or which can prevent this disease in vulnerable people. Until we have those, and the probability of having those anytime in the next calendar year are incredibly small, and I think we should be realistic about that, we're going to have to rely on other social measures, which of course are very socially disruptive.
And so really, essentially what he's saying there, Maruf, is that, you know, this is going to carry on for quite a long time, actually. And he's talking about till the end of the year. Now, because he's not a politician, he's able to sort of give these sort of answers. You know, a politician probably couldn't be as frank as he was
at the moment. But until that point, that is what we will have to do, and it'll have to be the.
So he's talking about social disruption possibly till the end of the year. Therefore, even if the lockdown will not be, will end 100%. It seems to me it's going to be a phased approach, a very slow phased approach. We still have severe disruptions on people's day-to-day living.
That's right, and I think that's gonna carry on. I mean. And what we're seeing right now is the lack of understanding around, you know, what is happening around this subject is really sort of making the deaths sort of continually to go up. And what we're seeing is that there is now a gap between the deaths that they're reporting in hospitals and the gap between what is being the actual number. So, I mean, it's interesting. The Sky News reporter sort of did a really good analysis here.
that if you're going back over the course of the last few weeks, it was a very different picture when you were looking at all deaths from COVID-19. So deaths with COVID-19 on the death certificate, that's the black line there. Compare it to the white line. There's a difference there, isn't there? How much of a difference? Well, you get a sense if you look back on the 10th of April, we were told by the government back then that in hospitals, 8,958 people had died of COVID-19. Now we know, according to these new statistics, that actually the real death toll around then was 11,400.
And don't forget the FT yesterday said it's 41% higher. So this is probably even more of a conservative number.
Settings, so including in care homes.
Well, this is because the government, for the first time, this is the first time during the crisis that the ONS figure, the Office of National Statistics, have been able to combine the care home deaths from England and Wales together. I mean, let's be clear. The figures that we're seeing do not include Scotland and Northern Ireland. They're treated independently of the whole of the UK.
So this 28% doesn't even include Scotland and Northern Ireland and some of the other.
Northern Ireland.
So he's saying
they report independently.
So he's saying that the death toll should be 22, where I think it's about 18 at the moment.
Don't just rely on whether COVID-19 is on the death certificate.
So,
now the deaths in the community, if you're not being tested, Fahim, goes back to your original opening line. If you're not being tested, people won't know that they're dying from COVID if they're dying in the community or in a care home. This is a very worrying situation.
Yeah, I mean, I think if you look at sort of the care homes, it's even more frightening actually what you're seeing there, right? And I think the care homes are a real tragedy for all of society actually, and I think that number and the sheer size of it is quite frightening. And what's really happening is, if the government had been quite clear in those numbers early on, we could have actually been in a situation where people who had elderly relatives in care homes could have actually taken them out of there, and that's really the part that's quite upsetting, right? And so when you look at care homes, I mean, I think the article goes further into care homes itself and provides a deeper explanation into the numbers.
Registered as that or something else entirely. We just simply don't know. As well, as I was showing you with those unexplained deaths, when you look at care homes as well, this shows you the average of deaths going back to the start of the year, the first 10 weeks of the year. And again, it's a similar picture when you look at deaths in care homes. And have a look, you've got 1,500 excess deaths in care homes. How many of those are explained by COVID-19? 826, which means there is another 643 that just aren't explained by COVID-19. That's about 45% of excess deaths.
45% excess deaths that they don't have an explanation
to COVID-19. Now that means either we are undercounting COVID-19 deaths considerably. Even these supposedly most authoritative numbers might be undercounting COVID-19 deaths, or something else is going on. The good news is we may now be just about beyond.
So, I think
one of the questions I have, I mean, even in China, recently, about a week ago, the death toll in China was increased by 50% because of counting issues, is what they said. And everybody complained about the Chinese saying they undercounted. However, we seem to be having a similar situation here where we haven't got the true figures here either.
Yeah, because I think what happens is that when somebody dies, the underlying conditions may be the reason for the death, right? But it may have been prompted by COVID-19. So it's quite hard to know that. But what I don't understand is why it takes them so long, because you can't release a body until you get the death certificate, right? And once you've got the death certificate should record the cause of death. So the fact that they have almost a week and a half before they can report it, I just don't get that.
Well, what the doctors are doing is putting down pneumonia, bronchitis, asthma as the cause of death, which is being brought on by COVID. Because if they want to be precise on a death certificate, you should put down a number of causes. So they can put down pneumonia and COVID-19. Now, the issue here is, Fahim, and I'm picking this up by many people anecdotally, that even in hospitals, the hospitals are saying to their families, look, the person, if you're happy for us to write they died of COVID-19, you can get the body now. But if you're saying you're not happy with COVID-19, the body's going to stay here for several weeks until we report it to the coroner, until we have another cause of death. You're not going to get the body. So people are now saying, put COVID, just give us a body. Certainly if you're from a Muslim perspective or a Jewish perspective, where you want the body quick as possible to bury it.
Yeah, absolutely, absolutely. And I think you talked about the sort of the black and ethnic minority communities. I mean, obviously, there's some harrowing stories. I mean, these guys that you hear right now on this one, it's harrowing.
And prayed for her, and said, "Oh, you're looking really strong, aren't you? You're going to come through this. So you're struggling to breathe, but you look really, really well otherwise, and very strong. So you will come through this." I was really surprised, shocked to say the least, when a few hours later I was informed that she had actually passed. I did not expect that at all.
Research shows that people of Black, Asian and minority ethnic heritage are being disproportionately affected by coronavirus. Only 14% of people in England and Wales are from these backgrounds, yet they currently make up 34% of patients in critical care units. BBC News analysis of reports in the public domain show almost 3/4 of 51 healthcare workers who have died are from ethnic minority backgrounds.
You have a higher proportion of BAME population working in key roles, such as transport, taxi drivers, bus drivers, shopkeepers, supermarkets, all of which are necessary in the lockdown to provide essential services.
What I'm sort of a little confused about, and you probably see this more, is what Trevor Phillips said the other day, right? And so Trevor Phillips, he said that there's a lower death rate in the Muslim community because people are washing their hands more frequently. Yeah, I'm hearing that in the black and ethnic minority community there is a lot more. So which one is right?
Well, look, the issue you quite pointedly what you're saying there is, yes, there are people all washing, they're doing wuzu to do their prayers, etc. However, I think the core issue is, like your clip played, that more people are dying. And don't forget, even in the NHS, the first 10 doctors to die were from BME backgrounds. Even nurses are dying, even in the NHS. So it seems to be across the spectrum, Fahim. Is that what you're picking up? It's across the spectrum, whether you're working in the front line in the NHS or whether you're a member of the community doing frontline jobs which are providing services, they're all suffering. Consistent, the government have announced that they're going to be doing a review, but however, not many people hold much credibility in that review and what the outcome is going to be.
This is the guy who's in charge of the review.
This pandemic is a worry for us. It's a challenge for us, but we need to rise to that challenge. And what we need to do is look at what we can put in place right now to support our staff.
Dr. Naqvi believes a lot of the BAME workforce have a different work ethic, a more hands-on approach, he said, and that right now could be a huge downfall.
What we do know is that every member of our NHS workforce is absolutely committed to patient care. But there may be parts of the workforce that see working in the NHS as more of a vocation than an occupation.
72% of all health and social care staff who've died with COVID-19 are from a BAME background, but make up just 21% of the workforce. Around 19% of patients to die in hospitals in England were from ethnic minorities or mixed backgrounds, but that figure is proportionate to the population figures. The main difference is among Black, African and Caribbean patients, but the numbers here are small. And 10% of the data is missing. The population figures are dated, and the two regions with the highest number of deaths, London and the Midlands, are also the most.
So I mean, I think what's clear, I think, is the fact that no matter whether you're in the States or you're in the UK or wherever, where you have people who have jobs that are desk-based jobs, they're able to self-isolate themselves. Where people have jobs which requires them to go out, supermarkets, taxi drivers, bus drivers, hospital workers, all of these people are disproportionately from lower, from ethnic minorities because they're lower paid. So if you look at a nurse and these sort of professions, they're lower paid jobs. So for example, even if you wanted to come in right now, under the new government scheme, you couldn't even come in because you don't even meet the salary targets. And so what's happening is that you have that sort of group who are in the front line, as they call it. And so this is more of a sort of a class or a job related issue, as well as a health issue. Now, what you don't see in the statistics is if one doctor or nurse dies of COVID, how many other people associated with that person have died, right? So we're hearing that 40 or 50 people have died, but what we don't get the number is how many others associated with that person have died. That's what you will get the
that's the contact tracing bit. Has this not laid bare the social injustices in the Western countries? It seems to be consistent in the Western countries. Yeah, let's be clear. In America, you've outlined the same thing. It's probably consistent across Europe, France, Spain, and Italy, where they've seen a burden as well. Certainly here in the UK, that these people, and is it because of lack of opportunity, lack of education, lack of support, that they're actually suffering this? Now it's just come to the bear. Everybody's frailties have now been shown as a society and as an individual.
Well, I think Corbyn was saying this for many, many years when he was leader of the opposition, that we need to value certain key workers. And I think there has been a sort of a realization that, he may have actually got something right. Okay.
So, moving forward, do you think, one thing I think is clear, I've interviewed quite a few members of parliament and then from the opposition, and they've said now isn't the time to point out the problems in the strategy in the government. Now is the time to rally behind the country. I understand that. That's what happens in a time of crisis or a time of war. But actually, if they consistently keep on failing with testing, no tracing, there's issues around the package that they've put in place for self-employed people, surely this is the time to be asking those critical questions and being part of possibly a unity government, or at least the opposition sitting on Cobra and being able to contribute to those debates.
Well, you would say that, wouldn't you? When you don't have a complete idea of what you're doing, you wouldn't want to be in a situation where people are questioning you. And I think that sort of transition period from Corbyn to Keir Starmer, they didn't quite know what to do. If they had the same sort of combative approach they had with Brexit, it would have seen that they'd sort of it just felt the wrong thing to do. But what's happened is if they were more combative, if they were more inquisitive in terms of what they were asking the government and holding them to account, maybe we wouldn't have had so many mistakes. Right now, the only person who's really asking the questions is Piers Morgan. Every morning you see him, he attacks them. And so,
absolutely. Yeah. Well, let me famous. Let's just close. We're coming to the end of the show, and just tell me then what should happen over the next 2 or 3 weeks. We're going into Ramadan. The government have extended the lockdown in the UK for another 3 weeks, possibly to be reviewed towards end of May. What would you like to see happen in the next three weeks? And is it even going to be possible? They've been asking for PPE, and it's took Turkey to give a donation to help the UK out. Surely we can't be in a situation like this going forward.
So if you just think about it, just over 2 months ago, there was only a few cases and a few deaths, right? A few months on, we've got nearly 20,000 deaths, and God knows how many people have got it. And so if you open it up right now, what you're going to have is you don't know how many people have got it, because a lot more people have it now than they had it a few months ago. So the only way you can do this is contact tracing and isolating those people that have got it. Until you get to that point, which means that you need to test. And if you remember, that wasn't my quote. That's a quote that the World Health Organization did almost two months ago, right? So this is ultimately the way you get out of this. And there are enough technology out there to identify who's got it, where they are, and also making sure that when people are traveling from one place to the other, you have temperature controls, you understand testing. And so these are the only ways that you can get out of this.
That's a topic we're going to be discussing. We're going to be talking about these issues, and certainly contact tracing and the implications for privacy. This is one of the big issues what a lot of the Western countries aren't picking up. You see a different approach in South Korea, China, and maybe in the Middle East and places where they're happy to have these kind of tools. But we thank you all. Fahim, thank you for coming on the show. And everybody, we want you to stay tuned for the future editions of Newsroom 365's Situation Room, where we'll be talking about the latest current crisis. We're going to continue with the coronavirus crisis for the next show as well. So in the meantime, have a fantastic day. Take care. Do stay safe and stay home and protect the NHS.
Thank you. Bye-bye.